Riding bikes is probably the most defining thing in my life, and the second most defining thing is probably the fact that I've lived with these mental health problems largely the bulk of my life. I moved to Colorado, to try to make a change, to try to start a new life. You kind of think that things are going to have this profound change just because you moved to a new location, and of course, I found out really quickly when I moved here that although it was probably a positive change for me, that I didn't entirely leave my former life behind, and then I kind of carried, all of my mental health struggles, westward with me. One of the most significant differences I noticed right off the bat when I moved to Colorado, in 2011, I had come from a pretty robust mental health network. Suburban Philadelphia, has that area, and the East Coast in general has a long history of providing services to those in need. So when I came out here, it really struck me that in a town of 400,000 people or how many ever we had at that time, there was really what I felt like maybe limited services, and certainly not ones that were readily known. Somebody who's already struggling and maybe already in the throes of dealing with a pretty serious condition, you also have to have the additional stressor of, finding necessary services, calling this person, calling that person, calling your insurance. It's those barriers that I think just compound everything. With people seeking care for mental health, on one hand, it's, kind of our access problems and maybe lack of resources that we have in care, but I also feel like it's are we providing the right care? Mental health problems in anybody are a little bit more complex than, say, some, more straightforward physical problems, and yet I feel like with our medical model that we kind of address them in the same way. It's hard, though, to create a system that's going to address all of those things. But we also have to be mindful that not every treatment modality that we're offering is going to be suitable or even and beneficial to everybody. And I would even venture to say, there's been a lot of things that I've been through that have actually traumatized me more than they've helped, So I think how we address, the scope of, of mental health issues and how we treat that is really significant. There's certain things that people feel very strongly that are individual problems, and then there's other things that we view more as community issues. And I feel that a little bit more here, probably in Colorado, than I did in Pennsylvania. The most profound thing that I know helped in my life, and I think there's lots of evidence-based studies that show the benefits of this, is really connecting someone with community. And if we continue to view things as individual problems rather than something that someone in the community could support, I think that's probably to our disadvantage. I feel like riding bikes has really saved my life. I just feel like without this this interest in bikes that kind of lights me up, what would I be doing? I'm never gonna stop riding bikes.